Hi, this is Nancy Shaw. I'm here in the States, but I'm visiting Dave Sheehan in Australia to talk on the Connect show about the work that is so exciting dealing with chronic pain.
Kia ora, I'm Florence.
Kia ora, I'm Bernie, and we're the co-chairs of Massage New Zealand.
We are very excited to be returning to an in-person conference in 2023.
We will be partnering with Massage and Myotherapy Australia and giving our Aussie friends a big New Zealand no mai haere mai welcome.
The 2023 host city is Auckland, and the conference will be held on the 27th and 28th of May.
For more information, visit massagemyotherapy.com.au, and from all of us Kiwis,
where the bloody hell are ya?
Hey everyone, Anne Davey here, CEO from Massage and Myotherapy Australia, and I'm here with our Queensland elected National Director, Stacey Parfitt. So hi Stacey.
Hi Anne, how you going? Hi everyone.
I'm good. Yeah. So we've got some really exciting news to talk about. The association has developed a couple of new scholarship initiatives, and they're actually your initiatives. So do you want to talk about it?
Sure. I'm really excited about some of these scholarships that are coming to fruition across the board with a few of the directors, but in particular, my initiative for this year is a couple of scholarships regarding rural and remote education. So I live regionally, and I've always lived in a rural or remote area, and I've always found education really difficult geographically and financially in regards to massage therapy. So I wanted to try to make that easier for other regional members across Australia, and that's what my initiatives are about and these scholarships are about.
Fantastic. And we've actually got two, haven't we?
There are. One is for an individual member to come to a CPE event in a metro area, and another one is a community scholarship. So get together with your other massage friends. Only one massage therapist in that group has to be a member of Massage and Myotherapy Australia, and the association will actually send a CPE event out to a regional area.
That's so exciting, because the feedback we get from members all the time in regional and remote is it's difficult to get to any event. So I'm super excited about it. So check out our website, look at our socials, and download the application form.
Good luck, everyone.
Hi, my name is Roger Gooch, and together with my colleague Joe Rowley, we will be presenting at the Myotherapy Australia and Massage New Zealand joint conference, which is in late May this year. Our workshop will be on analysing movement and developing interventions using an holistic framework known as ecological dynamics theory. We hope to see you all there.
Everybody, it's Dave Sheehan here from the Connect show. I'm extremely excited to have Nancy Shaw on this month's episode of Connect. Welcome, Nancy.
Oh, thank you for inviting me. I've been very excited about visiting with you.
Now, Nancy, we're really privileged to have you along because Travell Simons is they're very well-known authors back here in Oz. Talked lots about in curriculum. As far as massage myotherapy is concerned back in Australia. And you've got a direct link from a mentoring point of view with Dr. Janet Travell some years ago. So can you give the folks at home a little bit of a backstory on where things sit with that relationship and the Myofascial Pain and Dysfunction books?
Yeah, she was a renowned cardiologist. but saw that so much chronic pain still existed, even though medicine was fixing structure. And she realized that muscles didn't need to be fixed. They needed to be taught different patterns. So I called her office one day to see if I could find her autobiography. They said it wasn't printed anymore, gave me the name of a bookfinder, and I hung up. But then 30 minutes later, Dr. Travell called, wanted to know who I was that wanted her autobiography. And I thought, ooh, maybe I did something wrong. But anyway, long story short, she invited me to visit. And she lived in Washington. And so I went to visit, thought I'd play 20 minutes, maybe stay. It was 4 hours later. And she asked me when I was coming back. And that started a journey of 13 years of studying and teaching and speaking with her.
Wow, that's a big chunk of time, Nancy. That's pretty amazing. Now, also, many of the folks at home may not realize, but she was also the physician for JFK, for John Kennedy, yeah?
That's right. She had actually been the physician to the Kennedy family in New York. And when he was injured in a PT military incident and had a very bad back. And so she was treating him for that. And he called her to, because it was getting better, she actually turned it around and got him off crutches and capable of running for the presidency. So he called her one day from Florida and said, I want you down here tomorrow. So she went because who he was. And he said, I'm running for the presidency. And when I win, you're going with me to the White House. And which was the only White House woman physician and the only non-military woman physician. And she went, and that started the whole work. I wish I could turn this and show you a Kennedy rocker. She developed and designed the Kennedy rocker for him, which he used, and he virtually had, the back was not an issue during his presidency.
Wow. So that relationship began actually before he was elected as president.
Exactly.
Yeah. Okay.
And it was interesting because I was supposed, in between, there was a short break for 9 months, 10 months when I came to Perth. She had said I could go for 6 weeks. And I kept getting these little notations that she thought on her calendar had been a little longer. So I came back and continued for another 6-7 years. Wow,
fantastic. Well, I can't imagine how amazing that experience would be to set you up for other things in life. And from a career point of view, you've produced this pretty amazing book called Simple Changes to End Chronic Pain. Now, I think I read somewhere in one of the little bios that you referred to chronic pain. Musculoskeletal pain covers off on around about 85% of all chronic pain. You've been quoted in saying. So obviously it's a condition that affects so many people in the world. And the book is both a self-help, but is there also something in it for practitioners?
Yes and no. Practitioners work, their goal is to make sick people well and to fix problems, structural problems. The only thing they've really done with muscles is if you tear a muscle or cut it, they can sew it back together, but they can't tell you why you have a bad golf swing. And so that was pretty much left up to physical therapists, but they, in following traditional medicine, did much more strengthening. And Dr. Travell saw that. She was a renowned cardiologist, and she gave that up, studied the late 1800 German literature, and found that you couldn't do evidentiary studies or comparative studies because everybody has the same muscles. They can have the same back pain, but what they did with their muscles separately is what caused their back pain. So she realized that muscles act independent of every other system in a sense in the body, and we teach them whatever lessons we want them to work. So if a muscle, the best example I can use is a bucket of water that once you put enough drops in, it overflows. Each one originally is no big deal. If you think of a muscle as a bucket of tension, and every time you use a muscle, that puts tension in. And you put more in, put more in. It doesn't bother us, so we just keep going. But if I ask you or anyone else, where are you tight? You could tell me. It's like, oh, my shoulder, my back, my hamstrings. And that's because the bucket's getting full. But instead of emptying it, which no one really taught anybody, we change how we use it. In other words, one of our biggest discoveries, I think, was that 99% of back pain comes from two muscles in the front of the body, have nothing to do with the back. The core, rectus abdominis, and the iliopsoas. Rectus abdominis gives you a pain pattern across the lumbar area, and the iliopsoas up and down parallel to the spine. So 90-some%, 90, close to 99% of most chronic back pain comes from those two muscles being tight. And if you think about it, everything we do all day is going forward, forward. We don't do things going backward. So that bucket gets filled. It can take days, weeks, months, depending on what kind of job you have. So you can have the same back pain, and someone else's may have started 2 months ago because their job is bending forward on an assembly line. Someone else is totally different, so it takes a lot longer, but they have the same pain. But their treatment has always been the same. Medicine has treated the pain site. And the other huge discovery she made was that trigger points have a referral pattern. Where you feel the pain is not where it comes from. And here's the wall charts in the medical text. Every chapter is a muscle and has the documented patterns, trigger point and documented patterns. So in the treatment protocol, you would go backward, you would do range of motion and see what's tight, and then see in your mind, those tight muscles have what trigger points that go where. And you could, just by doing that kind of evaluation quickly with the patient, you can tell them where their pain is without them saying a word.
Yeah,
and so
yeah.
She would have patients bring photographs. It's like a doctor wants an x-ray. She wanted photographs of all their sitting positions, computer, reading, eating, television, all those things, so she could see how they were using the muscle, how they were compromising the position of a muscle, and then sleeping, all the sleep positions, their pillow, their shoes, everything. She said, that's a jigsaw puzzle. That gives you every piece that you need to get them better. That's 75% in the text, the main first chapter. She says that the perpetuating factors are 75% of getting a patient better. And without the photos, you can't see that. And sometimes patients say, well, I'll show you when I come in. I'll say, no, it's not your chairs and your pillows and that sort of thing. And then 15% is stretch rehab, not strengthening. Strengthening adds contraction. Everybody agrees that the muscles are weak, but if they're weak because they're too tight, then the last thing you want to do is strengthen, which adds more contraction. And she would say length is strength.
So when you look at Vladimir Jander's upper lower cross syndrome, the defining factors of that, does that translate across to what Janet Travell's talking about there as well, from those types of muscle groups where you've got shortened and tired?
They're not tired. The only reason they're tired is because they're too short. Not because a lot of times therapy has been in the past working a muscle to fatigue to build strength. And she would say if the muscle is already really tight, it is fatigued because it's got half a muscle trying to do a whole job. And it's going to be weak. I can do a shake hands position and shorten if you just put your hands out like this, put your hands out just a second, and just naturally. And you see how the fingers curl in some? Yeah. That's because the forearm has tight muscles. But we don't do anything about that. I had a kid with muscle. This was his resting hand position because he was on a crew team.
Okay, so that's tone that's created through the muscular. Yeah.
So the fatigue is because it doesn't have its whole self to work with. But if it's too tight, it's only got half power. So you don't want to strengthen. You want to release the potential that can lead to full power. And so 15% of the rehab, after looking at the pictures and making those changes, that's all we do. My first consult with the patient's 3 hours, just going over that stuff. And
Fantastic.
then 15% is stretch retraining. And the other concept with that is that you only do, and she was adamant about this, you only do 2 reps. You hold it for 2 breaths every 2 hours.
Right.
She's frequency teaches muscle memory.
Yeah.
If you do 3 sets of 10 twice a day, the whole rest of the day, the muscles just go back to what they know. So if you do 2, 2, and 2, then the frequency, the muscles start saying, "Oh, we can do that. Why didn't you tell us that's what we want?" That's and
that makes sense. Rather than binge exercising, just have that regularity to what you're doing as far as a stretch is concerned.
Exactly.
Yeah.
And then when that happens, the patient can do it all day.
Yeah.
Sometimes they can get 3 sets of 30 reps or whatever. But I had one guy say, "There's no way I can do that." And I said, "Wait a minute, 2 reps, 2 breaths, 2 every 2 hours. So that's 2 breaths, 2 reps. How long did that just take you? 10 seconds every 2 hours." So it makes it workable for the patient. And when they do that every 2 hours, they get focused on the fact that they have control over their pain. And that's huge from a psychological point of view. It's huge. It's like, and if they call and they say, "Well, it's a little better, but not much." And I'll say, "How'd you do on the stretches?" "Well, I didn't get them in quite as much." I said, "Okay, do them for the next 2 days and then call me." And they'll call back and say, "You won't believe this. It's so much better."
Well, we've got these wonderful things called, modern phones, cell phones, mobile phones, we call them here in Australia. And I guess you could set yourself an alarm every 2 hours. You've got no excuse, right?
Exactly what they do.
Too
Exactly
easy.
what and because it's such a short time, even if they're doing something important, they can take 15 seconds. Even with if they're sitting with the client, some of them will say, "Excuse me, just give me 15 seconds and I'll be right back." And they just stand up where they are and they do whatever and they go right back. Some of the people for hand things sit and do it at a red light. They'll sit doing some stretching because they're sitting there doing nothing.
Brushing your teeth in the morning and at night. There you go. There's two other times of the day that you could be stretching.
But those are 2 times that you're bending forward usually.
Depends.
Not necessarily, but those are the kind of times: brushing your teeth, washing your hands, just being in an upright position and taking, you can do a semi-lunge position with your legs and hips while you're, washing your hands.
That's it.
It's built-in success. It's built-in success. And instead of, Terrell used to say, and one of the doctors, that muscles became the stepchild in medicine because they were kind of ignored, because no one was trained to do what she did. And so it's been fascinating. She had a photographic memory. So
it's been quite a legacy. I mean, and again, you're probably very much aware that in Australia, as far as scope, it's within our scope to train up and do what we would consider dry needling. So the whole concept around trigger points is, it's very familiar with the education that we get out here in Oz. And the dry needling aspect is, for a lot of people, that's their main bread and butter as far as being a practitioner these days. So, and they get amazing results with that.
And I think if with one curve in that, they could be even much better if they treated the pain origin instead of the pain site. If they went back from where the pain is to where it came from and triggered that, that's the trigger point that's really set off the pain here.
As opposed to the referral.
Right. Instead of doing the front of the shoulder, that comes from one of the scapular muscles. Treat the scapula and this goes away.
Okay. Yeah. Nancy, we're kind of running out of time, but what's up for 2023 for you?
Well, it's exciting. I'm writing a small booklet on the 10 best discoveries of Janet Travell.
Oh wow, great!
And I'm working with her family has set up a foundation, Janet Trail Foundation, and I'm going to be working with that quite a bit.
Yeah.
And Rayleigh and I have some things planned for teaching segments of the protocol. Travell has a 7-step protocol that she's adamant about. And there was actually a paper that was just written, and I found it today. It was a book that we're looking to work on, myofascial trigger point therapy, what's missing? And the answer was the Travell protocol.
There you go. So that's the work that you're going to start working on throughout 2023.
I still run a clinic full time. I've had the clinic 40 years and still love the work. During COVID, I did most of it by FaceTime. I could, because you can do all these perpetuating factors by FaceTime.
Yes. Yeah.
They send the pictures. I go in their house and help them make changes, give them the stretches. And most of them, I would say 80, 86, 87% better without me ever seeing them.
Well, once we get off this interview, know that you've been analyzing how I've been sitting and everything. You might be able to give me some tips. Nancy, it's been absolutely fantastic to have you on our little Connect show. Maybe we should get you back once you've got this little bit of writing together on these missing factors of Travell. That'd be really interesting. Yeah,
I would enjoy it. Thank you.
Well, I wish you all the very best for it, and I hope 2023 is full of lots of love and lots of fun things and experiences to come for you.
And for you.
All right. Appreciate your time, Nancy.
Thank you.
Thanks for being on Connect.